Risk Management Roundup number 2, 10 Noteworthy Risk-Related LinkedIn Posts. Hi everyone. Recently I posted a roundup of 10 of my favorite risk-related LinkedIn posts that appeared in my feed during the prior week. I highlighted key points from each post with a short commentary about why I thought they mattered. You can find the link to that article below. As I shared in my last article, I have decided to start curating the most interesting and insightful risk related content on LinkedIn. The idea behind this initiative is simple. Many of our colleagues on LinkedIn are sharing so much knowledge and wisdom, but it often gets lost in the noise of our LinkedIn feed, which seems to be now cluttered mostly with promotional posts and advertisements. That is why it is important to capture these nuggets of wisdom so we can find them all in one place and return to them whenever we want. This is the best way to capture our collective knowledge and learn from each other. Let me know what you think. If you come across a risk related post on LinkedIn that you find particularly insightful, please share with me. And if it is your own post that you feel really excited about, I'm happy to consider that as well. So here are the top 10 noteworthy risk-related LinkedIn posts that I came across in my feed recently. LinkedIn post number 1. Randy Horton spotlights top 10 health hazards for 2024 compiled by ECRI. Key point. While new technology is enabling novel applications in healthcare to solve some of the most challenging problems, it is also introducing new risks. Why it matters. Technology is driving rapid innovation in healthcare delivery. Medical devices now operate in a dynamic and more complex healthcare delivery system. Connected device systems, software devices or SAMD, and digital therapeutics or DTX offer novel ways to care for patients, but they also introduce new hazards in the healthcare system. As Randy points out in this post, 4 of the top 10 hazards or risks identified by ECRI are related to these types of devices and therapeutics. Usability challenges with medical devices in the home environment is number 1. Number 2, insufficient governance of artificial intelligence in medical technologies. Number 3, ransomware as a critical threat to the healthcare sector. And number 4, web analytics software and the misuse of patient data. It is important to track these emerging hazards and actively manage their associated risks to ensure patient safety. Read the full post in the link below and continue the conversation. LinkedIn post number 2. Marco Felsberger reminds us that planning is useful, but building capability is even more important to handle uncertainty in our complex world. Key point. Planning is important, but no amount of planning can fully prepare us to handle the inherent uncertainties of our complex, rapidly changing world. We need to also focus on building capabilities that prepare us to respond quickly before it is too late. Why it matters. Our world today is more complex than ever. Change happens fast, often without any warning, and in ways that cannot always be anticipated. The recent COVID-19 pandemic highlights the limits of our ability to foresee emerging risks of major consequences. No one could have foreseen the rapid disruption in life as usual at the global scale following the initial public discovery of the virus. Catastrophic events due to climate change is another example. Even a local event can lead to disruption at the global scale because of our interconnected world. What does it mean for risk practitioners? How do we prepare our organizations to face this highly uncertain world? Certainly, planning is important. If we fail to plan, we are almost certain to fail. But it is clear that planning is not sufficient. We have to also focus on building resilience so we can respond quickly to our changing environment. In the context of medical devices, it means that we need to build strong safety surveillance systems to quickly detect emerging signals and take timely action. You can find the full post in the link below and continue the conversation. LinkedIn post number 3. Chad Johnson explains how using a QFD can help us focus on the customer when building an FMEA. Key point: Failure modes and effects analysis, or FMEA, is a commonly used technique to ensure product reliability by identifying and controlling the risks of failure. Its effectiveness can be significantly enhanced by recognizing the customer of each FMEA and focusing on their specific needs. Why it matters. FMEA is commonly used in the medical device industry, often to the exclusion of any other method of analyzing, controlling, and evaluating risks to patients and users. When used to simply satisfy regulatory requirements, it is not particularly useful or effective in achieving patient safety. What if we applied a customer-first approach to FMEA analysis? The Quality Function Deployment, or QFD, is a tool that can help. As Chad explains in this post, quality function deployment says we start by understanding and clarifying what it is the customer wants and needs beyond the spoken word. Perhaps even more eye-opening can be recognizing who the actual customers of the FMEA are. Take a moment to think about how your design FMEA might change if you also consider the needs of your process teams who will be responsible for manufacturing the product specified by your design. Read the full post using the link below and continue the conversation. LinkedIn post number 4. Mark F. Witcher encourages us to take a systems view of risk instead of an event-based view during risk analysis. Key point: Risk is generally defined as the effect of uncertainty on objectives. This definition is not incorrect, but it is not sufficiently clear to fully understand the nature of risk. A systems view can help. Why it matters. The practice of risk management in the medical device industry is hard. It is not that there are no standards or guidance. Rather, the available guidance is not sufficiently clear for a practical application. As an example, the current view of risk as a potential outcome of a sequence of events does not help focus on various interactions within a complex system that may initiate a sequence of events in the first place. One consequence of this event-based view of risk is an excessive focus on FMEA as the only method of risk analysis. A system safety view, on the other hand, is about identification and integration of safety requirements at the system level. According to Mark, taking a systems view helps us see risk as impact of uncertainty on a system that produces objectives. Read the full post using the link below and continue the conversation. LinkedIn post number 5. Boris Gurevich shares a draft document from IMDRF on SAMD device considerations and risk characterization. Key point: Global regulatory approach to software as a medical device, or SAMD, is rapidly evolving in response to rapid innovation and application in the medical device space. A new draft document from the International Medical Device Regulators Forum, or IMDRF, SAMD Working Group, offers a glimpse into the evolving regulatory framework. Why it matters. A risk-focused characterization of a medical device software, including those involving applications of artificial intelligence and machine learning, proves to be quite challenging. One reason is that it is not always possible to identify and characterize software failures that may lead to unsafe consequences for patients and users. Risk characterization of SAMD should be considered in the context of its intended use and the use environment. In this post, Boris summarizes a few key questions to ask during this exercise. First, for intended use or intended purpose, ask these questions. Is the medical device software intended to be used as adjunctive or alongside other tools or treatment? Is the software output used for clinical decision making for diagnosis or therapeutic purposes? And number two, for linking to device description, ask this question. Does the user need to possess special technical expertise to understand the inputs and or outputs of the software? This 45-page draft document from IMDRF offers a detailed understanding of consideration for medical device software and risk characterization. It also provides examples of intended use or intended purpose statement, characterization features, software hazards, and associated risks. Read the full post using the link below and continue the conversation. LinkedIn post number 6. Darren Carlson highlights the omission of DHF, DMR, and DHR from the QMSR and how to map them under ISO 13485. Key point. Manufacturers who market their medical devices in the United States have been required to maintain records such as the Design History File or DHF, Device Master Record or DMR, and Device History Record DHR in their quality system to comply with FDA's quality system regulation. This is all about to change under the upcoming Quality Management System Regulation or QMSR due to go into effect in early 2026. Why it matters? The final rule amending the current quality system regulation has now been published. The new QMSR incorporates ISO 13485 2016 revision by way of a normative reference. Once QMSR goes into effect, device manufacturers will be required to comply with documentation requirements outlined in ISO 13485 and not in the current regulation. As a result, there will be no more DHF, DMR, or DHRs, rather a medical device file or MDF containing all required documents and records to comply with the new regulation. Darren points out that it will not be difficult to reconcile the DHF and DHR with the MDF requirements, but DMR could pose some challenges. FDA also recognized this issue in their response to comments in the QMSR, but bypassed it by saying that retaining the DMR requirement would be redundant and cause confusion. In response to a comment in the QMSR, FDA wrote, previously, product specifications, procedures for manufacturing, measuring, monitoring, and servicing, and requirements for installation were included in a manufacturer's DMR and will now be located in the manufacturer's MDF. Current documentation practices have been in place for more than 25 years. A transition to the MDF will not be straightforward. Read the full post using the link below and continue the conversation. LinkedIn post number 7. Jan Bigger shares a study that focuses on factors affecting patients' trust in AI for treatment decisions. Key point. AI-based applications in clinical decision making are on the rise, but patients are not yet ready to give up on their physicians. Why it matters? The techies may claim very high accuracy of output from their AI-based application, but clinical decisions using AI alone are not yet ready for prime time. In this post, Jan highlights these key points from a recent study investigating patients' trust in AI for making clinical decisions in treatment of localized prostate cancer. Insight number 1. Patients trust AI more when combined with physician oversight. Insight number 2. More technology-savvy patients are likely to trust AI more, regardless of age, education, or illness perception. And insight number 3. Patients prefer AI and physicians more than physicians or AI alone. Here is the key insight. The paper suggests that successful AI integration in healthcare requires careful consideration of patient preferences and trust dynamics, advocating for a collaborative approach between AI systems and physicians to optimize patient care. Read the full post using the link below and continue the conversation. LinkedIn post number 8. Joseph Kivedar shares a review article about risk prediction models using AI for diabetes care and unresolved issues for implementation. Key point. Type 2 diabetes is a highly challenging chronic condition for lifelong treatment management. AI tools trained using a multimodal approach offer more accurate risk prediction, but many implementation challenges still remain unresolved. Why it matters? Type 2 diabetes is a significant global health issue. In United States alone, an estimated 38 million Americans have diabetes according to CDC data accessed on February 2024, with nearly 90 to 95% diagnosed as type 2 diabetes. Early diagnosis and intervention can help delay or prevent the onset of diabetes and future health complications such as cardiovascular disease, kidney failure, and adult blindness. FDA has cleared several AI based applications for diabetes care in recent years. One area of intense research is predicting the risk of type 2 diabetes using AI. According to a review of 40 studies using AI for diabetes risk prediction, using a multi-model approach leads to a much higher accuracy. As an example, combining data from genomic, metabolomic, and clinical risk factors in the AI model results in a much higher accuracy compared to using genomics only or a clinical only model. Although these studies are promising, there are still many concerns for real-world implementation. Quality of data from multiple sources, complexity in model development, and model bias are significant challenges that will remain largely unresolved. Read the full post using the link below and continue the conversation. LinkedIn post number 9. Stefan Hunziker highlights an unintended consequence of ignoring correlation among individual risks. Key point. It is not uncommon to significantly underestimate the likelihood of occurrence of at least one risk when multiple risks are present. It gets worse if we ignore the correlation between risks. Why it matters. Risk of harm to patients and/or users from a medical device is generally a result of a combination of individual risks. The overall risk is affected by a combination of different risks, not just a few. Further, many of these individual risks may be correlated to each other. Ignoring these relationships can have the unintended consequence of severely underestimating the overall risk. Stefan uses a simple example to illustrate this point. Let us say there are 3 individual risks, each with a likelihood of occurrence of 5%. This does not mean that there's only a 5% chance that one or more risks may actually be realized. A simple math shows that there's actually a 14.26% chance of at least one risk occurring in a certain time frame. Now, if these 3 risks are correlated, even weakly, with a correlation coefficient of 0.3, the revised estimate for at least one risk occurring is 40.13%. This is one reason the overall benefit risk evaluation for a medical device proves to be very challenging in practice. It is not an exact science, and the example above illustrates why we need to include a clinical perspective to fully understand this complex relationship. Read the full post using the link below and continue the conversation. LinkedIn post number 10. Anne-Marie Nicholson shows how HFE activities interact with multiple work streams during design and development. Key point. Human factors engineering, or HFE, is more than a practice of isolated activities to deliver results from usability studies for the purpose of regulatory compliance. A more effective HFE process is suitably integrated with multiple work streams during the design and development process. Why it matters. A significant component of risk from a medical device comes from how it is used in the use environment. This is why ISO 14971 requires careful consideration of the intended use and reasonably foreseeable misuse of a medical device as part of the risk analysis process. In practice, however, this aspect of risk analysis is done in an isolated manner, often as an afterthought when a usability study is deemed necessary for regulatory approval. Conceptually, risk practitioners understand that HFE needs to be integrated throughout the design and development process. However, it proves to be quite difficult in practice to achieve an efficient integration with different work streams. In this post, Anne-Marie shares a simple graphic to illustrate various connecting points between HFE activities and other work streams during the design and development process. This is a good way to develop and implement a strategy for HFE that supports product design, development, and timely market introduction. Read the full post using the link below and continue the conversation. Well, these are the top 10 noteworthy risk related posts recently on LinkedIn. I hope you enjoyed this reading of my article. Let me know your thoughts and comments below and share what else you have in mind. If there are other posts that come to your attention that are related to risk and you would want me to highlight them in a future article, please share them with me. Thank you for listening.